Okay, my name is Dr. Karen Schwartkoff Genswein. I work for Agriculture and Agri-Food Canada in Lethbridge, Alberta. I'm a senior research scientist with an expertise in beef cattle welfare. So the title of my first presentation was Lameness in Feedlot Cattle and What We Can Do and What We Know. This presentation was a summary of the recent work we've completed on feedlot lameness. It was a 3-year study, 2 full years in the field collecting data on lame cattle. And essentially from that work we really realized, there wasn't much work done in feedlot lameness, and so it really was a gap in the literature and in the research, and in terms of even what the producers will know and what can help them economically in their feed yard. We did see that from a pilot study that we did that lameness was, at least in the chronic pens, accounted for 30 to 50% of the lame animals that they saw in those feedlot pens. So it kind of triggered the whole process in terms of putting together a proposal and actually showing that, you know, this is a bigger issue than we actually think that it is. Once we started the study, essentially the study we did had 2 parts. It was a live animal study and a health records study. So the health records that we used actually came from about 29 feed yards, and we had, they range in size from 2,000 to 15,000 head. And we had over 111,000 head of cattle on that health record study. And we were able to look at animal risk factors such as the sex, breed, rectal temperature, body weight, body condition score, those types of things. And then in terms of animal management, so what types of diets were there being fed, the amount of forage and silage in those diets, bunk space allowance, what else? I had a list of 20 things and it's hard to remember. And then in terms of actual environmental factors that can be linked back to lameness, such as precipitation, the season in the feed yard, the pen conditions, and those types of things. So that's what we collected in the health records portion. In the live animal study, we actually worked with 2 feed yards, 2 commercial yards, over 10,000 head. And there we actually collected, we were in the feed yards once a week with each of those feedlots, and we had the cowboys pull the animals, the lame cattle that they were going to treat for the day. We took those animals and did a gait score assessment on them first, and then we brought them into the facility and we collected a myriad of physiological and other behavioral measurements, including looking at knowing exactly what foot the lameness occurred on, where the lesion occurred, what the lesion looked like, and kind of just putting in detail what that lesion actually was and if we could diagnose it. Then we took a bunch of physiological measurements. So those measurements included the hormone stress cortisol, or the stress hormone cortisol in the saliva and in the hair. And then we had other blood parameters such as immune function, so white blood cell counts, neutrophil lymphocyte ratios. We looked at acute phase proteins, so those are indicators of inflammation or tissue injury. We followed, took the rectal temperature of those animals. We looked at body condition score. And then we did infrared thermography of their limbs so we could see if there's any inflammation that way. And we did a very thorough assessment. We lifted up each foot and we made sure we did a thorough assessment so we could make the diagnosis. And with that, we also had the records on how many times they were treated, when they were treated, with what drugs they were treated, so we could make the assessment back and deal with the causative factors that was related to the diagnosis that we made. In that study, what did we find? Now my head is spinning again. So the biggest thing that came out of the study was that lameness was really a much larger issue in the feedlot than we anticipated. I think it was only second to respiratory disease. So if I'm remembering my numbers properly, the respiratory disease was at about 45% of the animals treated, and lameness was in about the 30% range. So it's substantially higher than what we anticipated, and the cost associated with that lameness, we calculated at about $81 per head. So that's not including the drug costs themselves, but that's just the labor and time to actually to pull those animals and treat them. In terms of some of the bigger issues that I think we could really help producers with in terms of how to mitigate lameness, the biggest thing is diagnosis. So if you can't diagnose properly, you can't treat them properly. I think lots of people are averse to actually pulling up those feet and looking at them, but I think it's an absolute necessity if you're going to get a handle on the problem. It's just usually cowboys treat this all as foot rot, and so it's not appropriate. Many times we have an emerging new lameness issue in the feed yard, and that's digital dermatitis. We've seen quite a large increase in our local yards. Many of the producers didn't know the difference between digital dermatitis and foot rot, for example. And so part of our job would be to train them to diagnose properly. There are definite differences and different characteristics of those lamenesses that the producers could really easily learn. And so once they're aware of digital dermatitis is very painful, and you can see the different lesion stages, we could easily teach the producers what that looks like, as opposed to foot rot, which is really causes a lot of swelling in the claw area. And so if they know the difference between even those two main lamenesses that we saw, I think it would help greatly, because the treatments are quite different. In terms of risk factors, so handling turned out to be quite a large risk factor. We did see that after processing or reprocessing or reimplanting those animals, the severe lameness increased by about 38%. So that tells us that the fewer amount of times you can handle those cattle, the better, because every time you handle them, there's potential for injury. In terms of their origin, we know that auction market cattle are twice as likely to become lame than ranch-derived cattle. And then even in terms of the type we looked at, we had, I believe it was winter place cattle, and winter place cattle were at least 2 times likely to become lame than their Holstein counterparts. So there's lots of information there. I mean, this is kind of the tip of the iceberg. We probably have 3 or 4 different papers that we can write from this information. Certainly bunk space has a great impact, and if the for every 1 meter increase in bunk space, lameness can decrease by about 1.5%. So there's lots of information there that we can use. We're going to use these physiological measurements that we've taken to help build a decision tree for the producers. So producers aren't going to use that information directly, but we'll make some assessments on what those measurements tell us in terms of the severity of each of those lamenesses, and we can build that into the decision tree as we develop it. So that's part of the goal, is to build a decision tree that will help producers for their treatments, and hopefully overall mitigate some of the lamenesses that we see. But I think this is, again, the tip of the iceberg. There's lots more work that needs to be done in this area. My second presentation was on transport, all the transport work that we've done almost in the last 10 years. We started with a benchmarking study. Essentially, transport, I think, is probably the most stressful event that the animals have to go through, because there's so many potential areas where stress can occur for those animals, whether it's loading and unloading, mixing at the auction, food and water deprivation, long times on the trailer, so you have fatigue there. So there's multiple stressors, and I'm going to say potential, because not in every case do all of those things cause stress to the animal at one time. We typically measure stress in transported cattle in 2 ways. One is behavior and one is physiology. We always combine those 2 measurements because we feel we get a much better indication of what's happening to the animal. And perhaps when we don't see in physiology, we may see quite clearly in the behavior. So we need to look at both of those. We need to collect those in a manner that's very non-invasive to the animals. So what we're measuring is actually due to the stress of the transport rather than some other cause, rather than our poking them with a needle and so on. So from that transport work, we started with a benchmarking study, and that study essentially was very pivotal in kind of showing us what the norms in the industry were and what the extremes in the industry were in terms of, transport distances, times on the truck, effective shrink on those animals, effective welfare outcomes. And here again, I think transport has a much bigger impact on our cattle than we once thought. Normally, those animals fat cattle can get to where they're going without much without much problem. They're very robust and can manage the rigors of transport. But animals like cull cows and calves have a much harder time navigating some of those things. So some of the major findings that we saw, essentially time on the trailer, if you kind of look at, if I had to select a criteria or select a time in which those animals should not be transported beyond, our data would indicate that about that 24 to 28 hours would be where that mark should sit, because beyond that we can see, if you look at the shrink, a graph of shrink, shrink really starts to plateau at about that 30-hour mark. So that means when we're getting to that point, the animals have lost all of the moisture they have, whether it's gut fill, whether it's urine, whether it's feces, and where the loss that you're continuing to see is most likely tissue loss. And we know that. We didn't measure that in that study, but we know that from other studies that have been done. So again, if I'm asked in terms of setting regulatory information, I would say that transport should, again, for the health and welfare of those cattle, not go beyond 24 hours. In terms of loading densities, that can greatly impact the welfare outcomes of those cattle, and we see many more dead, down, and lame animals when the loading density is below 0.5 meters squared per animal and above 1.5 meters squared per animal. And again, these are just data coming from that benchmarking work, so again, it might help us to know where those loading densities should be set. Conclude by saying overall, transport has a big impact on our animals. I think we really have to be conscientious about trailer design and so on in terms of airflow through the trailer, because if we consider that the temperature outside could be 30 degrees Celsius, on the inside of the trailer, those temperatures get magnified. We don't know that a stationary trailer, there is no airflow. And so we want to keep those trailers moving as much as we can, especially during hot weather. We do know that delays in transport can add a huge amount of time on the actual trailer or in transit time to a journey. And we have seen in some of our data that some of those delays include like border stops, rest stops for the drivers, mechanical breakdowns, traffic jams, and weather-related delays can be up to, we did record maximums of 15 hours. So that's on top of their actual journey that they have to go. And again, we know for every hour that's spent on the truck and for every 1 degree increase in temperature, there is increase in shrink loss and increase in poor welfare outcomes. So we can try and manage some of that. I think those are the things once we know, as Temple always says, we can manage what we can measure, and so this is the beginning of what we can start to know and how these things affect the animals on the trailer. Overall, I think training is where we have to start too, but once we know some of these cutoff points, we can put them into recommendations, and we hope to continue to do this work, because if you look into the literature, there's actually really not much transport-related research done under North American conditions, so we have to continue along with that. So